I want to talk today about the feminine principle. Now, I'm talking more in terms of archetypes. I'm not speaking about gender, I'm speaking about archetypes and principles. We'll talk a little bit later about yin and yang because I'm a student of Chinese medicine and a licensed acupuncturist. And so the feminine principle is what I truly feel is kind of missing in our culture and in our society today. The feminine principle is really about this idea that I receive in order to give, right? So in this slide here, we have just some basic imagery. Even the little supplements there are herbs and vitamins that are in a bowl. How often are we thinking about really receiving what's in there and wondering if our body is even taking in all of the nutrients that might be in that little capsule? And here's a picture of a woman getting a massage and just giving ourselves that time, not just to have a treatment or to take a pill, but or eat a food, that could be potentially good for us or nourishing. But this notion we're going to come back to a lot as it relates to the autonomic nervous system and the vagus nerve of what it really means to receive. In our society and culture, as I say, I think that this is a little depleted because many of us, and I work with a lot of women's health and patients who are women of all ages, have taken on the role of both. All of us have both yin and yang, masculine, feminine, and kind of can embrace and embody the entire spectrum. But if we're acting and doing and earning and protecting and getting into, taking care of everybody in the whole family and then out into our community and taking on so much, then the masculine kind of outshines the feminine and we can be in these more depleted states. So why I want to talk about the autonomic nervous system is because in my many years, I've been in clinical practice now 14 plus years, and I've really worked with a lot of degenerative illnesses and a lot in psychiatry and the mental health realm. So I'm often, as are I'm sure many of my colleagues who are in the audience today, the last stop practitioner or provider, right? I end up sitting in my office and, receiving phone calls from people who are interested in naturopathic medicine, who really may be feeling, people are commenting that they are feeling what I'm saying, and I really appreciate the feedback and the support, and just kind of, we can feel isolated in this way that here we are and we're working to support a larger group of people, and people may be having a hard time finding us, right? Because we're going out and we're seeking support from all of the different types of medical providers and still perhaps not getting the answers that we need. So then you end up looking for something like a naturopathic doctor or something else to really address your needs. So when there's complex things going on, what I've seen in 100% of cases is that the autonomic nervous system really is the unsung hero.